Technology is constantly adapting and changing the way we see the world. Because of this, many revolutionary medical devices have been developed within the last 10 years, reshaping medicine. One of these has been dubbed electronic aspirin, engineered to reduce the severity of neurological disorders such as migraines and cluster headaches. Migraines are characterized as a severe form of throbbing headache, lasting from a few hours to a few days. While migraines are a common example of a neurological disorder, with 20% of Australians experiencing them, cluster headaches are less common, with a frequency of only 1 in 1,000. However, the frequency of episodes is overshadowed by their intensity, described as excruciating by patients and one of the most painful syndromes known to man by their physicians. When talking about serious, possibly chronic conditions such as migraines or cluster headaches, typically the relied upon method of pain relief has been in the form of drugs. Traditionally, triptans have been an effective acute treatment. However, if the disorder is seen as chronic, preventative medications such as opioids may be prescribed. The issue here is that patients can frequently become reliant on this pain relief, building up tolerances to the drugs, which can lead to addiction and possible abuse. For this reason, the biomedical company Autonomic Technologies in 2013 designed an implant to replace much of the reliance patients have to harmful drugs. Named electronic aspirin for its effect to dull painful neurological stimuli, the device seen here is about 4 centimeters long and is patient controlled, implanted into the upper gum, and is directly connected to this sphenopalatine ganglion nerve cluster, with its purpose being to directly deliver low-level electrical stimulation to this area. So how is the device actually used? Well, at the first sign of headache-like stimuli, the patient places the implant receiver, this remote, up against the upper jaw, closest to the device, allowing for electrical impulses to be emitted through the nerves around the implant. And it is this current that reduces the pain and duration of migraines and cluster headaches for patients. So, what part of human physiology allows the device to be so effective? And how does this work? Well, firstly, the sphenopalatine ganglion nerve cluster, where the device is located, is directly connected to the 5th and largest of the cranial nerves, known as the trigeminal nerve, seen as the biggest nerve in this whole image. Being an important cranial nerve controlling sensations of the face, it is actually here where the device is able to prevent painful headache stimuli. Symptoms of headaches originate from pain receptors, also known as nociceptors, on the blood vessels of the dura and arachnoid matter of the brain's meninges. Activation of these nociceptors is conducted by unmyelinated C fibers and thinly myelinated alpha delta fibers of the peripheral nervous system. All such stimuli will propagate through the trigeminal nerve towards the thalamus, and it is this very propagation that electronic aspirin targets, even more specifically, the action potentials. Action potentials are just the body's method of sending information carrying signals throughout the body. During normal physiology, a successful action potential occurs after a local potential initiates a voltage increase to reach the neuron's threshold, located here. At 55 millivolts, sodium channels open and sodium floods the cell, causing this depolarization effect here, but once the voltage reaches 0 millivolts, potassium voltage channels open and potassium begins to leak out of the cell, resulting in a repolarization of the cell, hyperpolarizing it as it continues to be released out of the cell, and then the neuron will return to its resting membrane potential. So in order to interrupt these action potentials fired during normal physiology, electronic aspirin releases a high frequency electrical current through the implant and thus through the trigeminal nerve. Now, we will see how this current turns a normal action potential, which propagates through the trigeminal nerve, into an incomplete firing of neurons to drastically reduce the frequency of painful stimuli to the thalamus in the brain. It does this by prolonging the depolarization through artificially increasing this voltage. By doing so, it will inhibit an effective repolarization throughout and the return to a resting membrane potential while the device is turned on. Therefore, no action potential will propagate to the axon terminal, and no neurotransmitters will be released into the synaptic cleft. This theoretically is the physiology behind why the frequency of stimuli is reduced by electronic aspirin, as action potentials cannot carry out normal functioning in the presence of currents released by the device, and therefore no impulses travel through the trigeminal nerve to the thalamus of the brain. Clinical trials conducted by autonomic technologies on patients who experience chronic cluster headaches resulted in 68% showing significant reductions in the length and intensity of cluster headache symptoms. Furthermore, because of the device's specific targeting of action potentials, it eliminates many of the side effects related to other forms of pain management, being applicable to a wide range of patients suffering from chronic neurological disorders. Thank you.